Tobacco control is an enduring battle in the field of public health. The Department of Health of the Hong Kong Special Administrative Region Government has spared no effort in protecting the public from the hazard of tobacco use. Since the 1980s, with the progressive tightening of tobacco control measures, our smoking prevalence in Hong Kong has dropped from 23% in 1982 to 10.7% in 2012. For the past 3 decades, Hong Kong has gone through a rugged yet fruitful tobacco control journey. We were one of the first few places to ban smokeless tobacco, and now all forms of tobacco advertisement or sponsorship are banned in Hong Kong. In 2007, we further introduced an extensive expansion of smoking ban to cover all public indoor places and even some outdoor places such as public transport interchanges, public parks and beaches, in order to offer further protection of the public from second-hand smoke. In 2012, the Department Tobacco Control Office was designated by the World Health Organization as the collaborating center for smoking cessation and treatment of tobacco dependence. The center serves as a regional hub to provide support for training activities in the Western Pacific Regional Office.
The Tobacco Control Office in the Department of Health was set up in 2001. It was set up to coordinate the government's efforts in tobacco control and to protect the public against the hazards of smoking. The Government of Hong Kong Special Administration adopts a progressive and multi-pronged approach in tobacco control. This includes legislation, taxation, enforcement, as well as smoking cessation to discourage smoking and to contain the proliferation of tobacco use and protect public health. Smoking cessation has always been an integral part in our tobacco control policy, and over the years the government has been funding various NGOs, including the Dong Hwa Group of Hospitals, the Port Oil Hospital, to provide community-based cessation services free of charge, and they use counseling, nicotine replacement therapy, other drugs therapy, as well as acupuncture.
The Department of Health operates an integrated smoking cessation hotline in Hong Kong. It is manned by trained nurses. It is actually a one-stop service which provides counseling and referral to Smoking Cessation Center in Hong Kong.
Hong Kong Council on Smoking and Health is a statutory body set up in 1987 to raise public awareness on tobacco hazards and encourage smokers to quit smoking. A wide variety of education and publicity programs have been organized for all walks of life. Researches are conducted regularly to tie in with the progress of tobacco control. COSH also proactively advocated the government for strengthening the policies and collaborated with different sectors of the community to strive for a smoke-free Hong Kong.
The Tobacco Control Office of Department of Health has a dedicated enforcement team to enforce smoking ban in Hong Kong. We have a total of 99 full-time enforcement officers. They are responsible to carry out prompt investigation and initiate prosecutions against smoking offences and tobacco advertisement.
Tobacco Control Inspector will follow up all complaints and carry out surprise inspections to the no-smoking areas concerned. We will also proactively inspect venues where the smoking problem is serious. Smoking offences are detected during our inspections. Offenders will be prosecuted without prior warnings. We will issue fixed penalty notice to the offenders. In 2014, we have issued over 8,000 fixed penalty notices to smoking offenders, and most of our enforcement operations are smooth.
The Tobacco Control Office of Department of Health collaborates with non-government organizations to conduct school-based smoking prevention programs in Hong Kong. The Life Education Activity Program runs a very interactive education program for primary and secondary school students. The program is very well received by the students and teachers. We also collaborate with Bola & Gok to conduct a pilot smoking prevention program in kindergartens in Hong Kong. The pilot program is in progress right now, and we are doing evaluation, and the result will be ready soon.
I'm proud of Hong Kong's achievement, which owed much to the concerted efforts of many who contributed to our work. In particular, I would like to pay tribute to pioneers and partners in Hong Kong, including Professor Judith Mackay, the late Professor Tony Hadley, Professor T.H. Lam, and the former directors of health, including the late Professor S.H. Lee, Dr. Margaret Chan, and Dr. P.Y. Lam, for their vision and leadership. I'm also grateful to the Council on Smoking and Health, the academic sector, the non-government organizations, and the community for their support and hard work in tobacco control. We shall continue to work closely with various sectors in the community towards our next target of reaching single-digit smoking prevalence in Hong Kong. And I look forward to working closely with our overseas and international partners in meeting the challenges ahead.